Did you know that diabetes can be developing without you even realizing it? For many women over 40, the early signs of the disease are subtle but can seriously impact their quality of life. Type 2 diabetes is one of the most common conditions, and the number of cases is only growing, especially among older women. Did you know that many of them could be living with the disease without even knowing? Let's talk about these silent signs. Knowing these 10 signs is crucial for taking action quickly and avoiding serious complications. If you're over 40, this video is for you. Be sure to subscribe to the channel and like the video to get more tips on diabetes and health. Sign 1. Extreme fatigue, when tiredness is more than just being tired. Feeling constantly tired can be normal in some situations, but if that tiredness is unexplained and persistent, it could be a sign that something's wrong. With diabetes, the body struggles to use glucose properly, which leads to a constant feeling of fatigue. Even after a good night's sleep, you might feel drained, like you haven't rested enough. On top of that, excessive fatigue can be linked to other factors of diabetes, like dehydration. Frequent urination drains fluids from the body, and not staying properly hydrated can make the tiredness feel even worse. If you feel like you never have energy even after simple tasks, it could be a sign that your body is struggling with uncontrolled blood sugar levels. Sign 2. Increased thirst and hunger, what your body is trying to tell you. Increased thirst is a classic symptom of diabetes, but it's often overlooked. When blood glucose levels are high, the body tries to get rid of the excess sugar through urine, which leads to dehydration. This process makes you feel an intense thirst that won't go away, no matter how much you drink. Along with thirst, you might experience an unexplained increase in hunger. This happens because despite eating, the body can't use food effectively due to insulin resistance. As a result, you feel hungrier even if you haven't consumed extra calories. Pay attention to these changes in your appetite and hydration. They could be important warning signs. Sign 3. Frequent urination, a sign that something might be wrong. If you've been going to the bathroom way more often than usual, this could be a sign that your glucose levels are out of control. Diabetes causes high blood sugar levels, and the body tries to get rid of it through urine. This leads to a constant need to urinate, which can be uncomfortable and even make you feel like you never fully relieve yourself. This symptom can affect your daily life, especially at night when you might have to wake up several times to use the bathroom. Frequent urination can also come with a feeling of dehydration, since the excess urine causes a significant loss of fluids from the body. If you notice this happening, don't ignore it. It's important to see a doctor. Sign 4. Blurry vision, how diabetes affects your eyes. Blurry vision can be an early symptom of diabetes, especially when blood sugar levels have been high for long periods. This happens because excess glucose in the blood can affect the fluids in your eyes, altering their ability to focus properly. As a result, you might notice that your vision becomes blurry, making it harder to read or focus on objects in the distance. While blurry vision can be temporary, if glucose levels aren't controlled, the problem can worsen and lead to more serious complications like diabetic retinopathy. This condition affects the blood vessels in the eyes and can lead to vision loss. So, if you notice this symptom, it's important to get an eye checkup. Sign 5. Slow wound healing, a warning from your immune system. If you've noticed that cuts, scrapes, or wounds take longer than usual to heal, it could be a sign of diabetes. When blood sugar is out of control, the immune system doesn't work properly, making it harder for the body to repair itself. This means wounds stay exposed longer and are more likely to get infected. Additionally, poor circulation, which is common in people with diabetes, can also slow down healing. Wounds on areas like the feet can be especially problematic, as they may go unnoticed and turn into more serious issues like ulcers. If you notice a wound isn't healing as it should, see a doctor to investigate the cause. Sign 6. Unexplained weight loss, what your metabolism might be revealing. Have you noticed unexplained weight loss? When diabetes isn't controlled, the body starts burning muscle and fat for energy since glucose can't be used efficiently. This can lead to weight loss, even if you haven't changed your eating habits or started an exercise program. Additionally, weight loss can happen quickly and often without you realizing it. In severe cases, a person might even appear thinner, which is a clear sign that metabolism is being affected. If you've noticed sudden weight loss and can't figure out why, it's worth investigating the possibility of diabetes and seeking medical advice. A little-known natural ingredient that can lower your A1C from 7.7% to 5.6% while also helping you lose weight when used every morning with warm water has been pinned in the first comment of this video. Just check out the document and follow the steps to learn how to use it today. Sign 7. Tingling in hands and feet, diabetic neuropathy, and its early symptoms. Diabetic neuropathy is a common complication for people with long-term diabetes, but can start showing up before the disease is even diagnosed. One of the first signs of this condition is tingling or a burning sensation in the hands and feet. This happens because high glucose levels damage the nerves, affecting sensitivity. The tingling might be subtle at first, but tends to get worse over time, especially at night. Additionally, you may experience a loss of sensation in your extremities, making it harder to notice injuries or cuts on your hands or feet. If you're feeling tingling or numbness in your hands or feet, don't ignore it. It could be a sign of diabetes or neuropathy. Sign 8. Frequent infections. What diabetes does to your immunity. Women with diabetes are more prone to frequent infections, whether it's on the skin, in the urinary tract, or in the gums. High blood glucose weakens the immune system, making it harder to fight off infections. As a result, the body struggles more to combat bacteria and fungi, increasing the chances of recurring infections. If you've noticed you're getting infections more often, like urinary tract infections or yeast infections, this could be a sign that your glucose is out of control. Additionally, infections may take longer to heal, making the situation worse. Pay attention to the signs, and if infections keep happening, it's important to see a doctor to check for any underlying causes. Sign 9. Skin changes. How diabetes can leave its mark on your skin. Skin changes can be one of the first signs that diabetes is developing. Excess glucose in the blood can result in dry skin, itching, and even the appearance of dark spots, especially in areas like the neck, armpits, and groin. These spots are called acanthosis nigricans and are a visible sign of insulin resistance. Additionally, people with diabetes may experience slower healing and a higher tendency to develop boils or skin infections. If you notice your skin changing in unexplained ways, keep an eye on it and see a dermatologist. Diabetes can significantly affect skin health, making this sign an important one for early diagnosis. Sign 10. Hormonal changes and menstrual cycle. How diabetes impacts hormonal balance in women. For women over 40, hormonal changes related to menopause are common, but diabetes can amplify these effects. Insulin resistance can interfere with hormone production, which can lead to irregular menstrual cycles or changes in flow. Additionally, diabetes can make menopause symptoms worse, like hot flashes and mood swings. If you've noticed that your menstrual cycle is more irregular than usual, or if you're experiencing intensified menopause symptoms, it could be a sign that your blood sugar isn't under control. It's important to investigate whether diabetes could be behind these changes and seek medical advice for an accurate diagnosis. Be sure to subscribe to the channel and like the video. Now, click on the video popping up on your screen.